Hi everyone, welcome back to D Squared Classroom. Today we're going to talk about heart valves, which are really integral to proper blood flow through the heart. So making sure that the heart fills properly and that the heart is able to pump blood to the lungs and to the rest of the body. And you have 4 valves in your heart. We're going to go into each of them in detail today.
We'll start out, as we often do, with the 4 chambers of the heart: the left atrium, the right atrium, the left ventricle, and the right ventricle. The valves that allow blood to flow from the atria into the ventricles are aptly named the atrioventricular valves. These valves are open when the heart is at rest or in diastole and allows blood to fill the left and right ventricles. Let's now take a cross-section of the heart and draw it as if we were looking straight down at it so that we can see those valves between the atria and the ventricles. On the left side, you have what's called the mitral valve, and so this is going to allow blood to flow into the left ventricle. It has 2 sections, so it's called a bicuspid valve. On the right side, you have a tricuspid valve because it has 3 sections. Returning now to the normal view of the heart, let's zoom in on that mitral valve. I mentioned that it has 2 sections, making it a bicuspid valve, but it's not 2 solid sections. There's sections of tissue that sort of splay open, allowing for the best possible movement of blood. I like to think of them as tentacles, sort of like you'd see in an ocean creature. But these are opening and closing in time with the beating of the heart. And the 2 sections are often called leaflets. So you have 2 leaflets on the mitral valve and 3 leaflets on the tricuspid valve. Now let's move on to the other 2 valves in the heart, which allow blood to flow from the ventricle into the aorta and the pulmonary artery. These 2 valves open during systole, or when the heart is pumping, and they're called semilunar valves. They're named the aortic valve and the pulmonic valve, which is pretty easy because they go to the aorta and the pulmonary artery. And these have 3 leaflets, much like the tricuspid valve. Unfortunately, these heart valves are subject to disease, so let's talk about the types of valvular disease that are most common, starting with aortic stenosis. This is where you see a hardening on the leaflets of the valve over time, and that can impede blood flow and even start to pull the valve open so that it's not closing properly. Next, we'll discuss prolapse, which is often seen on the mitral valve on the left side of the heart. This is where one of the leaflets sort of gets pulled up, and this can affect the way that the valve opens and closes, where you start to see that it's actually pulling open on one side. This can ultimately lead to the 3rd type of valve disease, which is called regurgitation, or blood flow going in the wrong direction. Regurgitation can occur in any of the 4 valves. So with the aortic and pulmonic valve, that means that blood is flowing back into the ventricles. And with the mitral and tricuspid valve, it means that there's backflow of blood into the atria. This may eventually require a valve repair, where they try to fix the valve, or a valve replacement, which means that the valve is replaced with either a mechanical or some type of biologic valve. In the next episode, we'll go into those valve replacement options in more detail. Thanks for tuning in to D Squared Classroom.